Madam Speaker, I rise in support of House Resolution 1261, recognizing National Nurses Week. And I thank the leadership in the Congress for bringing this bill to the floor and acknowledge the close personal ties that many of us have with nurses. I'm very honored and pleased with my House colleagues and fellow nurses, Eddie Bernice Johnson for her leadership in introducing the legislation, and also Carol McCarthy. The recent debate in Congress on health care reform and the passage of the Patient Protection and Affordable Health Care Act have provided us an opportunity to highlight the importance of nurses to our health care system. Nurses are the backbone of healthcare delivery. And I know that because occasionally I'll be approached by a colleague who wants to tell me about the recent medical event in their lives, some situation, procedure, or a surgery, or some hospital stay. And inevitably, it isn't the kind of doctor care they had. It's the nurses that they want to tell me about, especially the outstanding ones that made all the difference in their recovery. And I know, because it is nurses who spend countless hours at patients' bedsides. It's nurses who are in all walks of life educating their communities about public health. And that's what I did for most of my career as a nurse, caring for the children and their families in our public school system in my community. Nurses are also case managers, they're health system administrators, they're educators, they're members of the military, they're primary providers, and this list goes on and on. So I'm proud to see our House of Representatives recognizing their immeasurable contributions that nurses make to the daily health and well-being of all Americans. Madam Speaker, I know that as individuals, we each recognize the important roles nurses play. Of course, too often, this recognition and appreciation doesn't come until after we've had our own adverse health experiences, as I've been relating to you. And as I said, many of my colleagues come up to me after a hospitalization or that of a family member. And again, they say, wow, if it hadn't been for the care of the nurses. Today, we have an opportunity to collectively thank and show appreciation to the nurses in our lives and all the nurses that serve our country every day in the armed services and in our communities, nurses who are our constituents and our family members and our friends, to renew our commitment to supporting the profession by providing greater opportunities for scholarship and loan repayment, just as we did in our newly enacted health reform law. We have a shortage of nurses and other health providers, and we want to do what we can to increase their numbers so that better patient care can be delivered. We need to also increase funding for existing programs to improve the training and recruitment of our next generation of nurses. So I urge all my colleagues to support this resolution. I'm pleased to be standing on the floor in its favor, and now I yield back the balance of my time.
The gentlewoman yields back.